Hello guys, welcome to my channel Nandini's Fasting Process. So today I will discuss about what is shock and what are the causes of shock and what are the types of shock. So let's start the video. So what is shock? Shock is a life-threatening medical condition whereby the body suffers from insufficient blood flow throughout the body, and it is characterized by inadequate tissue perfusion in which there is the insufficient delivery of oxygen and nutrients to the body tissues and inadequate removal of the waste product from the tissue if untreated result in cell death, and these can damage the multiple organs. Clear? So shock is a life-threatening medical condition whereby the body suffers from insufficient blood flow throughout the body. Is called shock. Next, causes of shock like heart attack, heart failure, severe allergic reaction, spinal injuries, poisoning, internal or external bleeding, burns, persistent vomiting, persistent diarrhea, dehydration, infection, spinal injuries, drug reaction. Okay, so these are the factors can lead to shock. And then types of shock. So mainly 4 types of shock we can see. So here cardiogenic shock, hypovolemic shock, obstructive shock and distributive shock. Okay, so what is cardiogenic shock? Shock resulting from inadequate pumping action of the heart is the cardiogenic shock. So if the shock resulting from inadequate pumping action of the heart is the cardiogenic shock. And cardiogenic shock is a state in which the heart has been damaged so much that it is unable to supply enough blood to the organs of the body. Okay, so cardiogenic shock resulting from inadequate pumping action of the heart. Cardiogenic shock is a state in which the heart has been damaged so much that it is unable to supply enough blood to the organs of the body. Clear? This is the cardiogenic shock. And what are the clinical manifestations we can see in the cardiogenic shock? Like decreased cardiac output, pulmonary edema, increased CV pressure, chest pain or pressure, distended jugular veins, weak or absent pulse, arrhythmia, profuse sweating, moist skin, shortness of breath, pale skin color or cold to touch, and decreased mental status and loss of ability to concentrate. So these are the clinical manifestations we can see in the cardiogenic shock. Next, hypovolemic shock. Hypovolemic shock is an emergency condition in which severe blood and fluid loss makes the heart unable to pump enough blood to the body. Is the hypovolemic shock. Okay, so hypovolemic shock means is an emergency condition in which severe blood and fluid loss makes the heart unable to pump enough blood to the body. And this type of shock can cause many organs to stop working. Okay, and clinical manifestations of hypovolemic shock. So here we can see decreased cardiac output, hypotension means low blood pressure, then ineffective tissue perfusion, cold and clammy skin, cyanosis or pale skin color. It mainly due to lack of oxygen supply, and a rapid, weak and thready pulse, thirst and dry mouth, fatigue, anxiety, distracted look in the eyes, restlessness, altered mental state. Okay, so these are the clinical manifestations we can see in the hypovolemic shock. Next, obstructive shock. Obstructive shock occurs when there is a blockage of blood flow in the cardiovascular circuit outside the heart. Obstructive means obstruction, means blockage, right? So obstructive shock occurs when there is a blockage of blood flow in the cardiovascular circuit outside the heart. Clinical manifestation in the obstructive shock. So we can see tachycardia. Tachycardia means increased heart rate, and then tachypnea means increased respiratory rate, and then hypotension means low blood pressure, then cyanosis, and then oliguria means decreased urine output, and then altered mental status, then jugular veins distension, and pulsus paradoxus. Okay, so these are the clinical manifestation we can see in the obstructive shock. And then distributive shock. Distributive shock occurs when the peripheral vascular resistance is lost because of massive vasodilation of the peripheral circulation. Distributive shock include anaphylactic shock, septic shock, and neurogenic shock. Anaphylactic shock. So, a shock state resulting from severe allergic reaction producing overwhelming systemic vasodilation and relative hypovolemia. Anaphylactic shock occur due to the severe allergic reaction. Anaphylactic means allergic reaction. Okay. So, a shock state resulting from severe allergic reaction producing overwhelming systemic vasodilation and relative hypovolemia. Okay, and clinical manifestation of anaphylactic shock. So we can see skin eruptions and large bumps, localized edema, laryngeal edema, and severe bronchospasm, and weak and rapid pulse, breathlessness, cough, tachycardia, tachypnea, extremely apprehensive, hypotension, cyanosis, urticaria and pruritus, complain of a metallic taste. Okay, and then septic shock. Septic means infection, right? So here shock is caused by an overwhelming systemic infection and inflammation resulting in vasodilation and leading to hypotension. So septic shock means shock is caused by an overwhelming systemic infection and inflammation and resulting in vasodilation and leading to hypotension. That may lead to shock is the septic shock. Okay, and clinical manifestation. What are the clinical manifestation we can see in the septic shock? See here, pyrexia or fever, and then low or absent urine output, and then skin rash or discoloration, and then hypotension means low blood pressure, and then warm and sweaty skin, and then systemic leukocyte addition, reduced cardiac contractility, increased neutrophils, and DIC. Then neurogenic shock. Neurogenic shock occurs when the dysfunction or injury to the nervous system and causes extensive dilation of the peripheral blood vessels. So neurogenic shock occurs when the dysfunction or injury to the nervous system causes extensive dilation of the peripheral blood vessels. Clinical manifestation of neurogenic shock. So in the neurogenic shock we can see hypotension, altered mental status, bradycardia, increased heart rate, and skin that is warm and dry